afternoon. My name is Kristen Muscati. I'm the Chief Medical Officer at NCH Healthcare System and very excited to be with you all today. One of the reasons why we're having this conversation, and I'll introduce my panel of experts with me today, is really as we talk about the vaccine, we heard from our nurses as well as the community. Could you please address some of the issues around how the COVID-19 vaccine affects pregnancy as well as infertility concerns? And so we really wanted to have this conversation with our physicians today so that we can answer some of your questions. So I'll give a brief introduction. I'd like to introduce you to this very esteemed panel we've assembled here today, and then we'll walk you through some of our concerns that we've had in terms of pregnancy and really talk about the data today, as well as infertility. So with me here is Dr. Betsy Brothers, and she's been in private practice for 30 years, mostly in Naples. She received her medical school training from LSU and then her residency in Vanderbilt in Nashville, and has been an OB and GYN specialist here for many years. And then we also have Dr. Michael Alper, who joins us. He's double board certified in obstetrics and gynecology and reproductive endocrinology and infertility. He's an associate clinical professor in the Department of Obstetrics, Gynecology, and Reproductive Biology at Harvard Medical School, and also is involved in IVF Boston as their CEO and medical director for over 20 years. So thank you so much for taking time to join us from the north today. In addition, we also have Dr. Bruce Cohen. He's currently the director of our maternal fetal medicine program here at Naples Community Hospital. He also has served as Chief Executive Officer of the Boston Maternal Fetal Medicine, and he was Chief of Maternal Fetal Medicine at Beth Israel Deaconess Hospital in Boston, associated with Harvard Medical School. Also the Assistant Professor of OB and GYN, Obstetrics and Gynecology, and Reproductive Biology at Harvard. And then we also have with us here right to my left in person is Dr. Beckett, who serves as our department chair at NCH for obstetrics and gynecology and has been here for over 36 years in Naples, graduated at Albany Medical College, and then also at residency at St. Barnabas. So we have a wealth of experience with us today in terms of answering your questions on COVID-19 vaccination related to pregnancy as well as infertility. So very excited to have all of you here today. I think what we'll do is talk a little bit about pregnancy first, then shift to infertility, and then really open it up to questions for you so that our experts can answer everything for you today. Two things I just really wanted to bring forward. We have quite a bit of literature coming out every day related to this vaccine and its safety. And we've had a number of really key statement papers that I'm sure that our experts will be discussing. One is from the American Society for Reproductive Medicine, that's called ASHRM. And as you have here, the COVID-19 vaccination is recommended for women who are contemplating pregnancy or who are pregnant in order to minimize the risk themselves as well as for their pregnancy. We also have on the next one, the American College of Obstetrics and Gynecologists have a position paper on this as well. COVID-19 vaccination is the best method to reduce maternal fetal complications of COVID-19 infection among pregnant people. And then just for clarification, maternal fetal medicine specialists really are the experts in high-risk pregnancy. They strongly recommend that pregnant people get vaccinated, and vaccination is safe before, during, and after pregnancy. So I do want to bring those opinion papers out, but really want to turn it over at this point to talk a little bit about what our experts are telling their patients in the clinic, both nationally and locally. So Dr. Brothers, if you would help kick us off just in terms of what you're hearing from your patients and what you're telling them in terms of the COVID-19 vaccination and risks of pregnancy.
Yeah, this is actually the best time to be having this conversation because we actually have some data behind it. We have some opinions that are not just our personal opinions, but our opinions based on society information. So in the things that you just read really give us a lot of reassurance about what the offers can be. I have two daughters who are in healthcare right now, who are both, one's a physician, one's a nurse practitioner in hospitals that are very affected by COVID. And when this came out in January, that was their biggest concern because they heard I've heard that this will affect my ability to have children. I've heard that I shouldn't get it if I'm trying to get pregnant. And even at that time, the American College of OBGYN said, absolutely, if you have any risk factors to get it. Now we're able to say you should get it whether you have other risk factors or not, that we have found it to be safe. So with reassurance, I told my daughters to get it. I've told my patients as well. The other issues that we've had as far as what impact will it have on my ability to get pregnant, that has recently been answered as well. The information on will it affect my menstrual cycle when I ovulate, the answers come back actually no, that our ability to have regular cycles, it doesn't seem to cause any more difficulty than any normal group of women's cycle control. So we have a lot of reassurance as far as fertility. In fact, they came out and said, even if you got the vaccine and then get pregnant, we do recommend that you get the second vaccine. So anytime in pregnancy or pre-pregnancy, it has been found to be an effective way to decrease any risks of COVID. And yes, the risks of COVID are actually worse than the risks of the vaccine. And we'll speak, Dr. Cohn, I'm sure will speak into that as far as what we're seeing in the hospital now. I mean, just in our personal practice, during the initial outbreak of COVID, we had no patients in the intensive care unit in our practice. And in the past month, we've had 5 patients who've been admitted to the intensive care unit who've been pregnant. These are previously healthy women with no other risk factors besides being pregnant who actually ended up in the intensive care unit. So it is becoming a significant issue in our pregnant population.
Oh, I appreciate that. And then do we want to shift to infertility, Dr. Elpers, and continue the conversation in terms of what you're seeing up north and what you're basically counseling your patients related to infertility?
Great, thank you, and it's a pleasure to be here. Thanks for inviting me to participate. So in the area of infertility, this has been a sort of a moving target. When the vaccine was first started, we didn't really have much data, objective data. We all had feelings about it, but didn't have a lot of objective data. And as I believe Dr. Brothers was stating that when the professional organizations like the American Society of Reproductive Medicine encourages both fertile and infertile patients to be vaccinated, it means a lot, because these organizations tend to be quite conservative, very thorough in their analysis before they come up with a recommendation. So I would take an opinion or position from the ASRM or the American College of OBGYN quite seriously. What we're seeing here, and it's no different in most other places in the country, is that physicians are strongly encouraging patients to be vaccinated. The effects of COVID are so serious, and hundreds of thousands of patients have perished as a result of this in the United States, that anything that we can do to reduce that risk in infertile or fertile women who are interested in conceiving should be considered. So when patients see us, I think if you were to ask me just a few months ago, I'd say, well, we're encouraging it, but now we feel quite strongly that all patients who are trying to conceive should seriously consider the vaccination. Now, for the subpopulation of infertility patients, and these are couples who have been trying for 6 to 12 months, depending on age, and have been unsuccessful, we also strongly recommend vaccination. As we all know, the virus tends to be quite severe in pregnancy. And which, a risk factor. So it's especially important to consider vaccination beforehand. All the data that's out there, which is limited, for example, there's no evidence that the vaccine has any effect on sperm. There was a paper published in JAMA in 2021 that showed that the vaccine, as would be expected, does not appear to affect sperm. And we also know, just from common sense, and literally hundreds of millions of people have been vaccinated, that it doesn't affect ovulation and it does not affect fertility. So we're strongly recommending that all infertile couples seriously consider being vaccinated.
Well, great. We really appreciate that. I think that sheds a lot of light on the infertility issue. So maybe Dr. Cohen and Dr. Beckett, we could shift a little bit to you and talk about more COVID and it specifically the virus itself, how it affects pregnancy. And then you could also talk about the safety related to the vaccine. So maybe Dr. Cohen, do you want to kick us off here?
So, the American College of OBGYN and the Society of Maternal Fetal Medicine Obstetricians have recommended very strongly that all pregnant women that do not have a severe allergic reaction to vaccines be vaccinated with the COVID vaccine. Now, despite these recommendations, we have to acknowledge that only about 23% of pregnant women are now vaccinated. And we realize when we approach our patients that this is a personal choice, that we're asking them to take a medication or a vaccine, as it were in this case, during the pregnant state. And that raises concerns both for mother and baby. And what I try to emphasize is that we understand that there are scientific limitations, both in assessing the benefits and risks of having this vaccine, and that ultimately the decision, yay or nay, to have the vaccine will be an imperfect decision because this is a relatively new virus and the data is limited. I feel that our job is to talk about the benefits and the risks and what actually is known. We know that these vaccines reduce the risk of infection by approximately 95% in non-pregnant subjects. We don't have any data directly on pregnant subjects, but there's no reason to think that there would be a large difference in that regard. We also know that there's a large reduction in the severity of disease for those who are infected that have been vaccinated. We know also that there are antibodies in the cord blood suggesting that in women that are vaccinated or who are exposed to the COVID virus, that there may be some protection for the neonate with antibodies traversing the placenta and into the cord and helping the baby. We know that 1 to 3 out of 1,000 pregnant women develop severe disease. And we know that women who are pregnant are 3 times more likely to be admitted to the ICU than women who are not pregnant, 2 to 3 times as likely to require mechanical ventilation than those who are not pregnant, and face a mild increased risk of dying from COVID compared to the same woman who is not pregnant. So pregnancy confers a significantly increased risk, may also well be associated with an increased risk of preterm delivery and stillbirth. And we know that 633,000 people have now died of this virus. Now, there are risks associated with the vaccine, and we have to acknowledge there are common side effects, such as fever, chills, sight pain, muscle, joint pain. There are rare side effects, like the 2.8 per million risk of anaphylaxis, or the 8.9 or 9 people out of 1 million that had thrombocytopenia with the Johnson & Johnson vaccine. But these risks of serious consequences are extremely, extremely small. We know that there have been studies in pregnant rabbits that found no increased risk of miscarriage or neonatal problems. And we know that there's the V-Safe pregnancy registry data. To date, 137,000 pregnant women have not only received the vaccine, but have reported with the registry data And there are no red flags going off in terms of miscarriage, gestational diabetes, preeclampsia, growth restriction, congenital abnormalities, stillbirths, or neonatal deaths. So based on all of the above data and based upon biological plausibility, we strongly recommend that all pregnant women receive the COVID-19 vaccine.
Well, we really appreciate that, Dr. Kwan. I think we're going to have to repeat it a couple times so that we can actually go through all that data that you just cited. So thank you so much for that. And then, Dr. Beckett, what you're seeing locally as well, what do you tell your patients and what is your recommendation regarding pregnancy?
Well, this weekend for me was a game changer because I was in the hospital and 2 full floors were occupied by Delta COVID positive patients. And, I went to see 6 pregnant women. And what was confusing to me is it didn't affect just their breathing, it affected their blood chemistry. And all of them had elevations in their liver function tests, which as an obstetrician would make us be concerned about preeclampsia. And in the event that that happens, you would want to deliver the patient because that was the treatment. But when you went in the room, they were not high hypertensive, they didn't have high blood pressure. They didn't complain of things, although confusingly they could say, well, I have headaches and some visual changes, which are other cardinal signs potentially of preeclampsia. So these women have 8 weeks to go in the pregnancy. So you don't want to end up jumping the gun and prematurely delivering a baby that is otherwise doing well. Plus, then I went down to the 2nd floor where is the intensive care unit and spoke to some of the respiratory therapists. And I peered in and saw some of my high-risk colleagues who are the intensivists who help me out and Dr. Brothers when we have tough situations, women with postpartum hemorrhage and whatnot. And they reassure us and they help us out, and their confidence is contagious to us. Well, they look scared, and they're running around and very nervous for sure. So I said, well, living in Southwest Florida, we live with hurricane, and you always categorize a 1, 2, or 5. And when I arrived here years ago, Andrew was coming. I'd never lived through one before. And some people say, oh, you can deal with a 1 or a 2 or even a 3, but a 4 or 5, you better get out of here. This Delta variant is like a 4 or potentially a 5. And I was personally vaccinated back in January, as were the other individuals here in the room. I didn't have, I think after the 2nd dose of Moderna, I had some symptoms that were related to the vaccine. But at the time, 10% of the women coming into our labor and delivery unit are positive for COVID and have absolutely no symptoms. So it's not the presence of the virus that necessarily produces a symptom. It's the body's reaction, to it. And I think when you get the vaccine, you might have some symptoms, but it's your reaction to, the vaccine. But better that than the reaction to the virus after witnessing what I saw this weekend.
No, I appreciate that. I too have been rounding with our physicians and like what we hear from Dr. Beckett, our pulmonary critical care docs are telling us this is different. It is more contagious. It is affecting younger people. And they are seeing different things in terms of whether it's the liver, sometimes it's the heart, than we saw with the previous surge last year. And so this is a different virus. I appreciate that. So I think we've given a lot of information in terms of infertility, in terms of pregnancy. One other question is, can I get the vaccine if I'm breastfeeding? I think that's one question I heard when I was out on the wards, and maybe Dr. Brothers, you could help us with that.
Absolutely, and that's as we recommended that you can be vaccinated now with assurance during any trimester. We're also saying don't limit it to not breastfeeding. And one of the advantages with breastfeeding, of course, is that you will make the antibodies, and they have found significant antibody. One of the myths that I hear is, well, am I going to shed the vaccine into the breast milk? Am I going to shed the vaccine? And this is not how these vaccines work. And so we really want to make sure that people understand that the way these messenger RNA vaccines, the Moderna and the Pfizer work, there is nothing, it does not have a virus in it. It is a small piece of basically DNA or RNA, which your body then copies to make a protein that is what makes our antibodies. And then the body degrades the portion of the vaccine. So there's no shedding of this in the breast milk. You don't shed any of this in the vaginal secretions, which is another thing people have said, that it really is a brilliant vaccine that only helps our body to make the antibodies. And those antibodies, which are healthy antibodies, are passed both through the umbilical cord to help the baby and into the breast milk to also hopefully prevent our newborns from being infected.
And I think that's a great point, because I think some of the misinformation that's out there, I mean, we want to be able to say this does not affect, that the vaccine itself does not affect the DNA of the ovaries or the reproductive system.
I want to just echo what Dr. Brother said. These vaccines are ingenious. These messenger RNAs enter the cytoplasm of the cell, causing protein synthesis to elicit the immune reaction, but they do not enter the cell's nucleus. So when people talk about these vaccines altering the genetics, these cells do not get into the cellular DNA. They don't enter the nucleus. And so this really is an ingenious method of delivering a vaccine.
No, I appreciate that, and I appreciate the science that we've been able to discuss. So I think it might be a great opportunity to pause here so that we can obviously have many of those here online ask questions, and we will answer them.
Okay, so we have two separate questions regarding the same topic on PCOS. The first is, does the vaccine affect fertility in women with PCOS that are actively trying to conceive? And there's a separate question saying, for any women who have PCOS, is there a vaccine that they should go for, whether Johnson & Johnson, Moderna, or Pfizer?
So let's define that for the audience too, whoever would like to answer that question.
Dr. Albert, do you want to?
Yeah, sure. It'd be a pleasure. So PCOS, for those who are not familiar, is a disorder of ovulation. It's a hormonal condition that affects many women. It's quite common. And it's associated with irregular cycles and some hormonal imbalances. And because it can affect ovulation, it can affect fertility, obviously. There's no evidence that the vaccine affects women with PCOS any differently than anybody else in terms of ovulation, which, as we know, just in clinical practice, millions of people have taken the vaccine, and there's no reports of ovulation disorders, hormonal imbalances, et cetera, et cetera. And I think we should use our common sense with this one. I would call the vaccine a miracle drug. It's probably one of the greatest advances in medicine in many years. It is saving thousands and hundreds of thousands of lives. And if you think about it logically, if a medication was given to hundreds of millions of people and there were some serious consequences from it, we'd be hearing about it. Dr. Cohn mentioned chills and fever, etc. These are minor side effects. The drug is incredibly safe, and many of my couples that seek treatment with us have received the vaccine, and there's no effect on ovulation or any of the hormones, nor would we expect there to be. So from a PCOS point of view, it should be treated the same way that it's treated if in a non-COVID environment. There's nothing special you need to do. There's no one vaccine that will cause a problem versus another vaccine. So the short answer is PCOS should be treated irrespective of vaccination state.
Great, very helpful. Other questions?
Can I receive the COVID-19 vaccine at any point of my pregnancy?
That was addressed in the recent ACOG recommendations, and the answer is absolutely yes. One of the concerns we've always had is there a slight increased risk of miscarriage with elevated temperature, and we do know that with these vaccines you can get an elevation of temperature. So, and of course that happens with COVID as well, but we would recommend that you treat that with Tylenol. So the same as we would with anyone, if you get a slight elevation in temperature, to treat that with Tylenol. So any trimester.
Another one, I had pulmonary embolism during my pregnancy. I had COVID, but some vaccines also cause. Should I be concerned?
Great question.
Going, what do you think?
I'm sorry, I couldn't hear the question.
We're going to repeat it for you.
I had pulmonary embolisms during my pregnancy. I understand this can be a side effect of COVID, but some vaccines have also caused PEs. Should I be concerned?
Well, we know we have not found any increased risk of thrombosis with the Moderna vaccine or the Pfizer vaccine. There's a very rare complication of the Johnson & Johnson vaccine, which is in the form of 9 in 1 million subjects, in which there was a thrombotic event. I think that the risk of COVID causing a thrombosis is so many hundreds of times greater than any even potential risk that the vaccine would cause a thrombosis, that certainly it would be in your interest to have the vaccine that would markedly reduce your overall risk of having a thrombosis, such as a pulmonary embolus during your pregnancy.
All right, this is a lengthy one. What is your conversation with individuals who bring up a recent news article stating that the vaccine content strongly accumulate in the ovaries? I have done a little research into this, and it sounds like it was a misinterpretation from a graph in the data. And how do you have a conversation about that with individuals who have this concern?
Okay, great. I think we did sort of address that in terms of is the vaccine itself accumulating in a DNA in the ovary?
No.
Right. The answer is no. Every piece that we can find is no. And Dr. Alper?
Well, there's just a lot of speculation that is just not founded on any really evidence. Take, for example, there was several months ago, there was an individual who commented that the spike protein on the virus is very similar to the spike protein on the placenta. And therefore, they were concerned that there's a potential of affecting, implantation and causing miscarriage. But there's no evidence to it. It's totally theoretical and really is no concern at all. But when these theories permeate around, it creates fear, but it's totally unfounded. There's really no evidence that the vaccine causes miscarriages or implantation failure. So that's just one example that I think, especially with the internet, these unfounded speculation is just spreads very quickly, but it's not based on any evidence at all.
Right, I agree with you, and I think that's part of our reason for meeting today is to talk about the misinformation that's there, but then to also not to be fear-based, but to let people know the risk on the other side should you not choose to get vaccinated. There is a risk there that we are seeing, as we've talked both nationally as well as locally, in terms of seeing pregnant women in the ICU, and this is different with Delta than what we saw with our first wave of the COVID virus in the past. So that I do want to also make sure that you are looking at the risk for yourself, your family, as well as your child with contracting COVID.
And that's to reiterate what Dr. Collins said. There is a reporting that happens for women who've been vaccinated that we're looking for any increased risk. And with over 100,000 women on this, we have not seen the risk of miscarriage. We have not seen growth restriction. We have not seen stillbirths or birth defects. So that's over 100,000 women who've received the vaccine who we're looking for problems. So that's a lot of reassurance.
I think another question that we've had come through our employees is, if I had a vaccine in my first trimester and recovered, I actually had COVID in my first trimester and recovered, should I still get the vaccine?
Well, it seems like the antibody response to the vaccine is far greater than the antibody response to experiencing COVID. So we would recommend that you still get the vaccine.
Well, I can tell you that our physicians also brought this question forward, and we had a journal club with our community physicians and medical staff last Thursday. We invited Dr. Poland, who's the chief vaccinologist at Mayo Clinic, to join us, and really looked at the science in a journal club format for this question. And what Dr. Cohen says is absolutely correct. What they found is that specifically the mRNA vaccines have a broader and deeper immunity response for Delta than if you had recovered from COVID antibodies, the natural antibodies themselves. So that is actually based in much of the science, as you say, Dr. Brothers, that is coming out, every day. So that has been reported that, in fact, we absolutely would recommend that. So any other questions we have coming in?
It was touched upon, but being asked multiple times if the vaccine affects fertility in young males and young men.
No, as far as the effect of both the virus and the vaccine on semen, the evidence is reassuring. In fact, there's one study that I mentioned earlier that was published in JAMA, one of the medical journals, and it showed that the vaccine has no effect on semen parameters. There has been several small series that looked at the effect of COVID on the COVID disease on semen parameters, and they have found that semen parameters are could be quite affected by the virus. But this is not a surprise that the virus does suppress sperm production, because we know that a lot of viruses, including the common cold, can actually cause azoospermia, or no sperm in the semen. So any illness, any viral illness can affect sperm. But if anything, I mean, from a fertility point of view, you want to be protected with the virus, with the vaccine, because certainly the virus can affect fertility by affecting sperm,
So that's
at least in the short term.
helpful information, absolutely. Any other questions? It looks like we've sort of concluded our questions here. Any other closing statements from our panel? I so appreciate all of you being here with us.
Yeah.
Oh, one more question, please hold.
Is there a website to learn more about the COVID numbers in Collier County and for Naples community?
Oh, absolutely. So you can go to nchmd.org and then it's /community-immunity. So we really are having a call for vaccination as well as masking for our community. So then I would open it up to the panelists each for any sort of summary statement. We're happy to close out.
I think that I just wanted to say that, we understand that to ask people to take medications or vaccinations during pregnancy can be a scary proposition for our patients. And I want, all of them to know that this is something that we do very thoughtfully. In this situation, the benefits so outweigh the risks that quite readily there is great consensus in the medical community. This is not a government thing or a political opinion. This is pure science. That the data that exists is so overwhelmingly positive and in favor of vaccinations that most of us feel an absolute obligation to tell our patients how great this vaccine is and how important it is for them to have the vaccine as they approach infertility therapy and pregnancy itself.
Well, I don't know that I could have stated it any better. I think one thing that, just to add to that, one thing that Dr. Poland said that really struck me is because it is about science, just as Dr. Cohen said, it's really his quote, when we deviate from the scientific method, we really lose our credibility. So really the goal here today was to talk to you transparently and openly about what we're seeing in Southwest Florida, what we're seeing across the nation, that this virus is different. And we do implore you to get vaccinated, both if you have infertility issues as well as seeking to become pregnant anytime during your pregnancy and after. So we hope this was helpful in terms of answering some of your questions. Happy to take more, free to email both me or more information on our Community Unity website. But I really have a great thanks to all of the panel members today. It was very helpful. I learned quite a bit and hope you did too. So with that, we'd like to sign off and thank you for attending.
Thanks for having us.
Yeah, pleasure. Take care now.
Thank you.